When it comes to breast cancer, there are just so many questions that come to our mind. Friends, family, online, हर जगह से we are often overloaded with so much information जिससे बस anxiety बढ़ती है. And more than that, half of which turns out to be misinformation. It's just so important to get the information from a reliable source and get answers to certain fundamental questions to understand breast cancer better. To help us with the right information, I have been joined today by Dr. Shona Nag, Director of the Oncology Department at Sahyadri Group of Hospitals in Pune. Hi, Dr. Shona. Welcome to the lovely podcast that we have, Hope and Healing. The first question that I actually want to begin with is, I know it's a fearful question, but whenever we talk about cancer, the word cancer comes and we are thrown off, and suddenly there's so much of fear. And everybody starts questioning why, ye hua kyun? Can you actually elucidate why does it happen in women? Why have the cases increased over these years? What would you explain?
So I think that's a very relevant question, बहुत important है. And if I knew the real reason and the perfect reason, we wouldn't be sitting here. And really cancer would be cured, हम सब घर में बैठते. लेकिन we don't know the exact reason, but we know that हमारे जो cells रहते हैं, normal cells,
Right.
they undergo some sort of damage. कुछ तो नुकसान पहुंचता है उन पे.
Right.
And then they start to mutate. मतलब genetic एक alteration होता है. Usually body is capable of repairing these alterations. लेकिन जब ये होता जाता है, then one mutation, second mutation, और आखिर में cancer हो जाता है. So it's a number of mistakes in a cell which cannot be corrected. Of course, जब breast cancer के बारे में हम बात करते हैं, तो it is important to know कि 10 to 15% are genetic. तो ये BRCA जीन जो है, ये अनुवांशिक है और इसके वजह से breast या ovarian cancer हो जाता है. But that does not explain 85% of the cancers.
Yes.
So a lot has to do with our lifestyle, जीवन शैली जो बोलते हैं. तो उसकी वजह से आजकल बहुत कैंसर बढ़ रहा है. आपने बिल्कुल ठीक कहा कि we are seeing so many cancer cases. When I started practice 30 साल पहले, almost 25-30 years ago, तब इतना कैंसर नहीं था.
Yeah,
For sure.
When I was just
For
reading some
sure.
of the statistics, it came across that the number of cases have doubled in India in the past 20 years.
Absolutely
ऐसा हम
right.
क्या कर रहे हैं? And since just 1 in 10, these are the number of cases जहाँ पर genetically, जहाँ पर BRCA1, BRCA2 gene positive होता है, जबकि
जी,
माँ बाप
बिल्कुल.
आपके माँ से या grandmother, paternal और maternal वहाँ से आता है, पर बाकी 85% of the cases, like you said, नहीं है.
नहीं है reason.
What can people? Nobody wants it. Nobody wants it. If there are like 5 to 6 things that you would like to tell us, okay, these could be the possible reasons. Of course, not the only reason. It could be a cumulative effect. What are those 5-6 reasons that can actually lead to women developing breast cancer?
So that's a very बहुत महत्वपूर्ण question पूछा आपने. And all I can say is there are risk factors. Risk factors ऐसे रहते हैं जो हम बदल सकते हैं, which we can change. And one thing important is lifestyle. So मोटापा, obesity is a very, very important cause of breast cancer. It stores estrogen hormone, the fat in the body.
Yes.
So the more fat you collect, estrogen ज़्यादा बढ़ जाता है, and उससे breast cancer को बढ़ावा मिल जाता है.
Right.
So that's something we can take care of.
Right.
Then our diet. आजकल क्या पेस्टिसाइड्स है खाने में, क्या केमिकल्स है. वी हैव टू गो बैक टू आवर चाइल्डहुड डाइट. जो बचपन में खाते थे वही खाओ.
Right.
हमारे जो बॉडीज हैं, दे आर नॉट मेंट फॉर पिज्जा एंड पास्ता एंड चीज. आई एम सॉरी, यही हो रहा है. यंगस्टर्स फाइंड इट वेरी टेस्टी, दे आर गोइंग फॉर इट, इवन ओल्डर पीपल. लेकिन ये जितना आप कम खा सको, मैं नहीं बोल रही कि बिल्कुल मत खाओ, बट like
In moderation.
moderate. Moderation is the key to preventing cancer.
Yes.
अगर मुझे एक शब्द यूज करना है, it would be moderation.
Yes.
Exercise. So we know cancer survivors में जो लोग exercises करते हैं, उनका recurrence का जो chance रहता है वो कम हो जाता है. This has been proven in studies.
Oh really? This
Yes.
I didn't know of. Okay.
If you can get rid of 10% of your body weight in the next 1 year after the cancer diagnosis, आपका रिस्क कम हो
But
जाता है
that's only
by
with obese
15.
people.
Yes,
Okay.
but see, a lot of people are overweight.
Mm-hmm.
हमें लगता है कि like 10-15% overweight ठीक है, नहीं है ठीक, because it's releasing chemicals which are harmful for your body, that
Right.
extra weight. So we have to be very careful with
Right.
that. And risk factors ऐसे भी रहते हैं जो we cannot change. So we can't change our race, we can't change our family history, तो बदल नहीं सकते हम
course.
लोग. फिर menstrual history बदल नहीं सकते. If we've had children, that's protective. Breastfeeding किया है तो वो बहुत protective है.
Yes.
कम से कम 6 महीने breastfeeding करना चाहिए.
But it's very informative for me as well, who has been in the thick of it. But yet it's so informative, very honestly. And this is rolling, and I'm glad you're getting this as well, because it's extremely informative, not just for the people who are watching this and listening to this, but for me as well, because I didn't know that if you lose 10% of your body fat,
You reduce your
you
risk. There are
reduce your
studies.
risk.
There are
And
studies.
I always thought it's in obese people, but then you said it's also in people who are little overweight, and there's
Yes.
nothing known as little overweight. You got to be in the healthy zone.
Yes, you got to be in the correct
Yeah, and if I
BMI.
summarize जो आपने कहा है, of course, lifestyle. A lot of people blame diet in the sense, like आपने बोला कि pizza, pasta, ये सब हमारे एक genetic memory में नहीं है. हमारे forefathers, ancestors
बिल्कुल,
नहीं खाते थे.
बिल्कुल,
So
बिल्कुल.
maybe it doesn't go down well with our system. I don't think it goes down with the Americans also, which has got the
They're
highest
obese.
obesity. So
Yes.
I don't think it goes down well anyone. But having said that, there's a lot of myths around things like sugar nahi khani, bilkul bhi nahi khani sugar. Go sugar free, go lactose free, go gluten free, and I won't call it fads. These are also dietary changes. But do these prevent or does sugar in itself contribute to the increased risk of cancer?
तो मेरे honestly speaking, जब patients मुझे मिलने आते हैं, the entire focus is usually on diet. And कभी कभी सुबह में आते हैं, दोपहर में आते हैं, and I start to feel hungry when they start asking, ये खा सकते हैं, वो खा सकते हैं, but like you rightly said, the most important question is, what is wrong with white sugar?
Yes.
All right? तो ये बहुत refined रहता है. White sugar gets stored in the body as fat when it is not required. तो वो एक कारण बन सकता है. And white sugar itself can create inflammation in the body. तो जब बोलते हैं ना, मैदा मत खाओ, white sugar मत खाओ, दूध कम पियो. So all the three whites create some sort of inflammation in the body.
I'm so glad, because very honestly, you're one of the first doctors who's telling this to me. Because when I ask the other doctors, they talk, of course, in a very, and of course we're talking about allopathy, and there's all science to it. So it's very symptomatic. सर दर्द हो रहा है तो डिस्प्रिन खाओ, पेट दर्द हो रहा है तो साइक्लोपैम खाओ. They don't go to the root of it. And you don't even believe in the other alternate, a lot of alternate medicines which are happening, and
Absolutely.
And to each their own. But if you ask me, I would rather go the allopathic, the scientific way of going about it.
Right.
But again, they're too symptomatic about it. कि अगर ये दर्द है तो ये लो, but not going to the root of it. So none of the doctors, of course, I've met many nutritionists and many lifestyle coaches is what they call. Like they actually wean you off all these things. As a doctor, they only talk about moderation, and they say there is no science which actually proves that there is.
Of course
that's
there
what
is.
I'm getting.
Of course
that white sugar can cause or
textbooks में लिखा है that a state of inflammation can be caused by a lot of these things.
A lot of sugar.
तो फिर हम हमारे patients को advise करते हैं, eat more millets. All right. Eat a lot of probiotics जैसे दही वगैरह. All right. Eat a higher protein diet.
Right.
क्योंकि cancer cells protein जो है body में वो deplete कर देते हैं. और हमें नुकसान पहुंचता है, muscle wasting हो जाता है.
Right.
So please eat a lot of protein.
Right.
And जो सब्जियां, जो fruits लाल, पीले और नारंगी कलर के होते हैं,
okay,
वो खाना है, क्योंकि उनमें ज्यादा बीटा कैरोटीन है.
लाल, पीले
और ऑरेंज, नारंगी.
Right. So
क्योंकि उसमें बीटा कैरोटीन है.
So red is carrots and orange, and the third color that you said was
पीला.
पीला क्या होता है?
कैप्सिकम.
मेरे को कद्दू वगैरह याद आ रहा था, but हाँ.
नहीं, कैप्सिकम है. फिर कैसे पम्पकिन बोलते हैं जी, बिल्कुल.
करेक्ट.
और फ्रूट्स में एप्पल है, तो
Right.
ऐसे काफी चीजें हैं.
Basically, good nutrition.
करेक्ट, एंटीऑक्सीडेंट्स बहुत ज्यादा होते हैं उसमें.
Right,
सो
right.
प्लीज फोकस ऑन दोस.
I was talking to two lovely, beautiful women who have survived with God's grace. Um, both of them didn't look like they fit into the category of obese or of not having children or of having not breastfed. And very honestly speaking, I didn't tick these boxes as well when I'd gone to the doctor. So yeah, he's like, you clearly don't look obese. Are you on alcohol? I was like, I don't do drugs, I don't do alcohol, I don't smoke. In fact, I was heavily into fitness. No history in the family, koi history nahi hai. When, and of course I had two children, so breastfed also. तो
So
ये सारे
absolutely no
then
risk
then I want to
factors.
ask
Why?
then I want to ask, potentially, I don't know if science has proven it or not, but does mental health have got to do with your physical well-being, and does it have implications on the deterioration of your health?
So that's a super question. Before I come to that, I just want to say that I don't know if people are aware, but our cancer cells are nothing but cells that have made mistakes. So there are 6 times in your lifetime where they are circulating in your body. That's the average. That's what we found. And the body's immunity is strong enough to kick these cells out.
Okay.
There comes a time in your life जब भी आपको बहुत stress हो या mentally you're going through a lot, because mind controls the body, not the other way around. Body can't control the mind, all right? And above the mind is the intellect that has thoughts in it. So the thoughts control the mind and the emotions, which controls the physical body. So obviously, when you're weakened due to some reason, and it well could be stress,
Yes.
you do succumb to getting that
The
cancer.
immunity drops.
Yes.
So there is a link.
Yes, and immunity plays a very strong role.
And what are those 6? आपने कहा जीवन में 6 बार होता है जब ये सेल आपके
They have
body में.
approximated this through years of research.
What are those time periods? I'm very intrigued.
If I knew that, I would tell you.
So
but
we don't
it
know
can
yet.
happen at any time.
Oh,
But
but
it's
6 times
average
it makes
6 times, yes.
in your lifetime it makes a circulation in the body.
There are these cells going on in your body.
So I think it's a very lovely input. ये मुझे नहीं पता था. तो अब वो अगर हमें पता नहीं है कि वो 6 बार कब हमारी बॉडी में सर्कुलेट करेंगे, so what is in our hands is to keep our immunity high at all times.
बिल्कुल.
And at times, physical well-being, you might look the fittest and you might look absolutely strong, but there could be storms and havoc in your mind.
Correct.
So, and stress has a big role to play in your immunity. So it's very important to have control. Nobody can control stress. Stress hoga zindagi mein.
But it's how you handle it.
Yeah, but it's how you handle it.
Of course.
And very honestly, in my case, not trying to make it personal, but I see there's a big population, big sample of the population where the women are leading beautiful lives, privileged lives, if I'm so to say, have access to resources, beautiful families and all of that. But maybe one thing common is our mental health. And mental health necessarily does not mean being depressed. It's also your capability of handling stress.
Correct.
And the stress that you take on your body. There is multiple hormones in our body going up and down all the time. अंदर सर्कस ही चला हुआ है प्रोजेस्टेरोन और ईस्ट्रोजन का. मेरा तो चला ही रहा है. तो there are sleepless nights, there are sleepful nights, there are restful nights, and I envy men only just during this time. यार तुम्हारे पास टेस्टोस्टेरोन है, हमारे पास बहुत कुछ है, and वो भी same रहता है till an age, and then it goes down. But for us, it's almost like a daily circus of hormones. So it is what it is. But if we can have a hold over our stress, we can save ourselves from our immunity going down.
Absolutely.
It's a personal request to all the people who are watching
it's
it.
So important.
It's so important that mental health, because we do hit the gym. We do. A lot of us are privileged. We afford a kiwi and an orange. But what do you do of all the thoughts that...
And the nature of the world is up and down.
It's up and down.
We are ruled by opposites.
Absolutely.
Hot, cold.
Absolutely.
Love, hate.
Absolutely.
bad.
The pandemic wasn't easy on us, and yesterday was a
Absolutely.
red alert, and
उसके
thankfully there's no
हाँ
rain today. But there's, as it is so much happening in the environment,
बिल्कुल
that
yeah.
the least that we can do is take control over our internal environment. That's nice. Okay, what can women do to detect breast cancer early?
तो मैं एक बहुत सिंपल चीज बताऊंगी आपको that something like self breast exam can save your life. तो इसका मतलब क्या होता है कि आप गूगल भी करें या किसी एक्सपर्ट से भी पूछें. नेक्स्ट टाइम यू सी योर गायनेक, नेक्स्ट टाइम यू सी योर स्पेशलिस्ट, प्लीज उनसे पूछिए कि ये सेल्फ ब्रेस्ट एग्जाम क्या है. सो वंस अ मंथ, आइदर 1 week आफ्टर योर पीरियड, अगर आपको मेनोपॉज हो देन मे बी अ फिक्स डे ऑफ द मंथ, you take 3 minutes out to do a self breast exam. What is that? The first step is आपको आईने में अपने आप को देखना है कि आपके ब्रेस्ट सेम लेवल पे अप्रॉक्सीमेटली हो. फिर आपको देखना है कि स्किन बिल्कुल नॉर्मल है. फिर हाथ ऊपर करके देखना है कि दोनों एक जैसे ऊपर जा रहे हैं. अगर एक में लंप हो तो वो नीचे जाएगा और एक ऊपर आएगा. तो लिटिल थिंग्स लाइक दैट. फिर जब आप फील करें आपको अपने ब्रेस्ट को, तो ऑलवेज फील इट विद द फ्लैट ऑफ योर हैंड. आप ऐसे आप फील करोगे तो सब जगह आपको लंप नजर आएगा या फील होगा. सो यू लर्न टू गो इन सर्कल्स फ्रॉम इनर टू आउटर, और बगल मत भूलना. सो राइट हैंड फॉर लेफ्ट ब्रेस्ट एंड लेफ्ट हैंड फॉर राइट ब्रेस्ट. दैट इज द वे वी डू इट. और मैं ये नहीं कह रही कि यू कैन डायग्नोज ब्रेस्ट कैंसर योरसेल्फ. आई एम जस्ट सेइंग कि आपका नॉर्मल क्या है, ये आप समझेंगे. जैसे आपका एज बढ़ेगा द फील विल चेंज, लेकिन आप अपने फील को पहचानेंगे. तो अगर कुछ अलग फील हो गया महीने में एक बार, तो आप तुरंत आप ठहरेंगे नहीं, 1-2 बार चेक करेंगे और फिर डॉक्टर के पास जाएंगे. तो इट इज नॉट, आप अपने आप मत डायग्नोज करो, लेकिन अपना नॉर्मल पहचानो. बहुत शाय है हमारे महिला, दे आर वेरी शाय.
I totally agree.
And ये doesn't help us at all.
It doesn't help us. And I would, shy से ज़्यादा, I think it's a societal, how we are brought up. It is a patriarchal society. So when I was going through it and I was meeting the doctors, and of course I never wanted to share my story with anyone because it's a personal setback.
Absolutely,
right? मैं क्यों share करूँ अपना दुख तकलीफ? I'll keep my smiling face. But when I spoke to the doctor said so many women miss their treatments because they're shy to tell their father-in-laws और द ब्रदर इन लॉ, क्योंकि हमारा सेटअप ऐसा है कि हम एक न्यूक्लियर फैमिली में नहीं रहते, ज़्यादातर जॉइंट फैमिलीज हैं, तो उसमें मर्द बहुत होते हैं. तो उनको कैसे बताएं कि हमारे ब्रेस्ट ही नहीं बोला जाता, यू नो, यू नॉट एबल टू से द वर्ड ब्रेस्ट, एंड तो वो कैसे बताएं कि उसमें चेंजेस हैं. then I was really surprised that this is leading to mortality. मतलब इससे आपकी it's causing
advanced stage, you're right,
you know.
Absolutely.
But so I think one is that we need to fight the mindset. आपकी बाजू है, आपका सर है, आपका नाक है, आपकी आंख है, आपके ब्रेस्ट है, आपका वजाइना है, आपके नीज है, आपकी फीट है. एक ही सांस में बोला मैंने, तो ये एक ही सांस की चीजें ही हैं ये. these are names of the organs that you have. something goes wrong, आपको दिखाना पड़ेगा. आई है तो आई स्पेशलिस्ट है, otherwise you go to a breast surgeon.
You're absolutely
but apart
right.
from that, what I also observed when I was sitting with the 2 survivors was they knew that there is something different. उन्होंने महसूस किया कि कुछ तो चेंज है, पर उन्होंने कहा चलो कल, चलो परसों, चलो आज नहीं, कभी और. 2 महीने वो अपने सिम्टम्स पे बैठे, क्योंकि एक मन में रहती है हम सबके कि यार बुरा हमारे साथ हो ही नहीं सकता. और ये बुरे वाली बात नहीं, क्योंकि अगर सोल्यूशन है तो कुछ भी बुरा नहीं है.
बहुत डर है इसके बारे में,
बहुत डर है. So they were even educated people were sitting on it. What would you like to say to the people who are even educated or not educated, to everybody? Is it okay to sit on your symptom for even one day?
It's absolutely not okay. क्योंकि एक बता दूं that if you come early, it can be completely cured. और बहुत से लेडीज मुझे बताते हैं कि दुख नहीं रहा था इसलिए हम नहीं आए. द डेंजरस पार्ट इज नहीं दुखना. इफ इट इज हर्टिंग, इट इज बिनाइन. कोई प्रॉब्लम नहीं. वो शायद कुछ इन्फेक्शन हो, कुछ और मैस्टाइटिस हो, लेकिन जब ये गांठ दुखती नहीं है, दैट इज द डेंजर सिग्नल. यू हैव टू कम. और कभी कभी जैसे आपने बताया, दीज लेडीज आर एजुकेटेड बट दे आर सो स्केर्ड ऑफ ट्रबलिंग में मैं बेटे को ट्रबल नहीं करना चाहती,
Yes.
बहू को ट्रबल नहीं करना चाहती, then the bahu sees that blood is dripping. These are the states that I have seen and I see this every day और मैं
So
बहुत
sad.
थक गई हूँ. I want to see no cancer, but I want to see early tumors that can be cured. और आजकल का cure rate in stage 1 is 97%.
I was coming to the next question. How treatable is it?
97%.
97%.
उससे अच्छा आप 97 marks घर लेकर आओ. How happy your parents will be.
Yes.
I mean, it's 97%. It's not 80%.
Yes.
So, science बहुत बढ़ चुका है and we need to be careful.
तो I think एक नजरिया है कि अगर अनफॉर्चुनेटली कई औरतों में सिम्टम्स उनको नहीं पता चलते, दैट इज बियॉन्ड आवर हैंड्स, बट अगर कुछ आपको दिखती हैं, सिम्टम्स दिखते हैं, आई थिंक टेक इट एज अ गिफ्ट फ्रॉम गॉड और गिफ्ट फ्रॉम द हेवंस अबव कि अगर है, गेट इट चेक्ड, कैंसर है, ओके, एटलीस्ट प्रॉब्लम तो पता चली, नाउ लेट्स गो ऑन टू द सॉल्यूशन.
बिल्कुल.
So one thing which was also common between the two survivors was that the first thing that they hit their mind was acceptance. हाँ मुझे है, अब next क्या? काफी लोग denial में रहते हैं.
बिल्कुल.
So how do you deal with those patients who are in denial?
It is difficult. इंडिया में काफी denial है and एक तो बता दूं कि family comes and says उन्हें कुछ मत बताओ, बताएंगे तो वो टूट जाएगी, हिम्मत हार जाएगी, कुछ कर नहीं पाएगी. I said, but उनकी जिंदगी है, she has a right to know.
Yes.
Let me do it my own way.
Yes.
I cannot lie to a patient.
Of course.
लेकिन घूम फिर के मैं जरूर बता सकती हूँ because I need her help to treat her properly.
Absolutely.
So I do that. And I always say कि अगर God ने आपको प्रॉब्लम दिया है तो उसका सल्यूशन है आपके पास. वो कभी नहीं प्रॉब्लम देगा you can't handle it.
Right, right.
So he only gives the problems that you can handle and it is known that you can handle. So you have to have that faith.
It's so beautiful to hear from a doctor the word God. And I want to ask you this one question. Do you believe in miracles, spirituality, higher power, positive affirmations? Because a lot of when we go to the doctors, they can say, हाँ वो तुम करते रहो जो तुमने करना है साइड पे, पहले chemotherapy लो. So they are particularly talking about that. But I want to ask you holistically, do these things help a patient get hope, strength, courage, or is it just a placebo?
No, I think it's very, very important. And I'm a student of Vedanta. I have been studying Vedanta for the last 20 years.
It's so lovely.
And my Guruji is Swami Parthasarathi.
Right.
And he has changed my life.
Wow.
He has helped me become a better oncologist, a more patient individual, and created a lot. So, मैं जब पेशेंट्स से बात करती हूँ, I use a lot of my Vedanta knowledge.
Wow.
जब बोलते हैं, अरे हमें गारंटी चाहिए, 100% हमें ठीक होना है. I said, आप मुझे गारंटी दो that I'm going to cross the road and be fine at the end of it and no car is going to hit me, then I will give you 100% guarantee. ऐसे बात करना पड़ता है उनसे to make them understand that we have a philosophy in India.
Of course.
हमारा spirituality world over लोग आते हैं करने के लिए.
Exactly.
हम खुद नहीं believe करते.
Right.
That there is so much power, strength, positivity in our own spirituality.
Wow.
And I tell them, अगर आपको अध्यात्मा या कोई गुरु जी है, please, this is the time, help लेना है आपको. You can't fight it alone. Sometimes family also पूरी टूट जाती है. They can't fight.
Right.
So take the help of someone with a higher intellect or higher support system and you know, get over this.
It's very heartening to know from a doctor about positivity and positive affirmations.
No, it helps. And you know, हम हंसते हैं और बोलते हैं alternative therapy में कुछ नहीं है. But homeopathy has a tremendous role in supportive care for cancer.
Oh, really?
Ayurveda also has it. Or
do you propagate it?
As long as it doesn't have heavy metals, as long as it doesn't interfere, 90% of our patients are taking it anyway. वो लेते हैं, बताते नहीं है, डॉक्टर को बहुत डरते हैं. लेकिन NCI नेशनल कैंसर इंस्टीट्यूट जो अमेरिका में है, वॉशिंगटन में, वहाँ एक यूनिट है which is studying complementary alternative medicine for cancer.
Wow.
Yes.
Oh, this is new to me. I've never
Yes.
heard a doctor say कि आयुर्वेदिक और होम्योपैथिक का
लेकिन
की
ये
भी help
स्टडी
ले
हो
सके.
रहा है, ये
That's
स्टडी हो
amazing.
रहा है, एंड इट विल कम इनटू मेन स्ट्रीम एट सम पॉइंट.
Yes.
सपोर्ट के लिए बहुत अच्छा है. आई एम नॉट सेइंग रिप्लेस इट.
Right. Of course not.
ऑन्कोलॉजिस्ट से बात करके साइड बाय
You
साइड.
can take support of it, but of course your treatment, you've got to take the treatment. You can't skip your
No,
chemotherapy
you can't
and go
skip
to.
your treatment.
You
That-
can't do that.
that
That's
is
a no.
not
That's a no.
negotiable.
That's a non-negotiable. Absolutely.
और जैसे लेडीज को कीमो के बाद हम हार्मोनल थेरेपी देते हैं.
Right.
हाँ, सो समटाइम्स वी गिव ड्रग्स लाइक लेट्रोजोल एंड एस्ट्रोजोल. ये लेके बहुत जॉइंट्स में दर्द होता है.
Yes.
Do you know abroad they have done an acupuncture study that acupuncture for 12 weeks can reduce the pain in the joint substantially, which is due to these drugs.
Imagine.
तो बहुत कुछ चल
When
रहा
will it
है.
come to India as a mandate?
No, I advise it to my patients.
Oh, that's
I
lovely.
said catch a good acupuncture, not acupressure, acupuncture,
Puncture.
and it will reduce your joint pains by 50%.
It's amazing.
Then yoga. Tata Hospital did a study of yoga during chemotherapy,
Mm-hmm.
and they found side effects were less.
You did a sample.
Yes, they did a sample series and presented it at the American conference.
Oh my God. Was it like accepted?
Yes, बिल्कुल डिस्कस हो गया था.
Wow.
हाँ.
So it's going back to our roots. It's basically just
What is yoga from our country only?
wow. That's
तो
amazing.
हमारे डे केयर में पूना में हम एक ताइची योगा एक्सपर्ट को बुलाते हैं. बेचारा वॉलंटियर करता है हफ्ते में एक बार, और पेशेंट्स का कीमो चल रहा है और वो सिटिंग ताइची और सिटिंग योगा करता है.
Wow.
And we are studying the effect of that.
So the one thing that I want to ask you is also that you just mentioned offline a few minutes back that the youngest patient was around 22, 26 years old, and they've been having the same in the family for over years. The grandmother had the mother, and so on and so forth. So if there is a young woman like that, is there a set mandate that she should get her mammogram done at a certain particular age?
So the advice to her is that 10 years earlier than her mother was first diagnosed with the tumor is the correct age. So agar the mother got the breast cancer at
Or the nearest
45 or
relative.
the closest relative, 45, then at 35 she should start her screening, जो मैमो बोलते हैं, सोनो बोलते हैं. ये जो BRCA caused breast cancer है, जो genetic बोलते हैं, तो usually we never test a normal person.
Right.
We always test the patient first, और उसमें कौन सी जीन की खराबी है वो पहले फाइंड आउट करते हैं, और फिर वही जीन हम
बेटी में
डॉटर में चेक कर सकते हैं जिसको प्रॉब्लम नहीं है. वी ऑलवेज प्रिफर टेस्टिंग अ नोन पेशेंट फर्स्ट फॉर द जीन, क्योंकि अगर हमने सिर्फ एसिम्टोमेटिक या बिन प्रॉब्लम के किसी को टेस्ट किया, then we'll never know which gene was responsible.
Of course, because
So
there's a
always
spectrum of
correct.
it. Yes.
So you always start with the affected person first.
Right, right. And there's this general वो एक डर लगा रहता है कि कीमोथेरेपी एक तो बताएं कि कीमोथेरेपी होता क्या है, and should people be afraid of it? What exactly is chemotherapy in the entire process of diagnosing and treating
So
breast cancer?
chemotherapy is actually chemicals that are given either intravenously or they are given orally to kill cancer cells. लेकिन एक प्रॉब्लम है, ये नॉर्मल सेल्स को भी अफेक्ट करते हैं. That is your fast growing normal cells like your hair, your skin, जो मुंह का लाइनिंग होता है, then your lining of the entire GI tract, तो उसकी वजह से डायरिया होता है, vomiting होता है, and it also affects the bone marrow, which you very well know. तो जैसे जैसे साल गुजर गए, last 30 years, 40 years, तो बहुत सारा इम्प्रूवमेंट हो गया है, नॉट इन द कीमोथेरेपी पर से, लेकिन जो सपोर्टिव केयर बोलते हैं.
Right.
और जैसे कंप्यूटर्स यूजर फ्रेंडली बन गए हैं,
Right.
वैसे कीमो पेशेंट फ्रेंडली बन गया है.
Right.
मतलब आजकल नैनो टेक्नोलॉजी यूज हो रहा है.
Right.
तो हमारे ड्रग्स भी काफी नैनो पार्टिकल्स में मिलते हैं, जो टारगेटेड कीमोथेरेपी बोलते हैं
Which I want to ask you next because
जिससे
yeah.
सेंसिटिविटी रिएक्शन नहीं होता है, वहीं का वहीं जाके पहुंचता है और इफेक्टिव रहता है
Right.
और लिवर पे भी जेंटल रहता है. तो ऐसे नैनो लाइपोसोमल
this is
प्रेपरेशन, नैनो
called
प्रेपरेशन.
targeted chemotherapy is different from chemotherapy.
टारगेटेड कीमो इज अ टाइप ऑफ कीमो जहां डिलीवरी सिस्टम और सोफिस्टिकेटेड है, जैसे
Right.
नैनो टेक्नोलॉजी, या उसको लाइपोसोमल जैसे कैप्सूल्स में आप बंद करके, माइक्रो कैप्सूल्स में बंद करके डिलीवर कर दो.
Right.
टारगेटेड थेरेपी इज डिफरेंट.
Okay.
अभी 2004 के बाद टारगेटेड थेरेपी आने लगा.
Yes.
ये क्या है? तो वी लर्न दैट कैंसर वाज जस्ट, कैसे कैंसर, हर स्टेप की मालूमात हमें हो गई लेबोरेटरी से. तो इसको हम ट्रांसलेशनल ऑन्कोलॉजी बोलते हैं, विच इज ट्रांसलेटेड फ्रॉम द बेंच वेयर द लैब पर्सन इज सिटिंग टू द बेड साइड, टू द पेशेंट. तो ये जो रिसर्च हुआ, it was fantastic, and we were able to come up with छोटे छोटे drugs, either oral, rarely IV, जो सिर्फ ट्यूमर सेल्स को मारते हैं और नॉर्मल सेल्स को बचाते हैं. So this is targeted therapy.
And then what is immunotherapy?
तो immunotherapy is more recent, and in fact 2018 में एलिसन हॉन्जो जो कपल है उनको एक नोबेल प्राइज मिला था मेडिसिन में, because they discovered that body का immune system is capable of handling cancer cells, but the cancer cell is so smart, जैसे जैसे बढ़ता है, it puts the immune system to sleep and it hides from the immune system. मतलब मास्क पहन के वो जाके अटैक करता है सबको.
Right.
और ये जो ड्रग्स हम डिस्कवर किए, इम्यूनोथेरेपी, वो मास्क निकाल देते हैं. तो हमारे जो टी सेल्स हैं जो वायरल इन्फेक्शंस, टीबी के विरोध फाइट करते हैं, वो अभी पहचानने लगते हैं कैंसर सेल्स को.
So there is no chemo drug going in. It's
No.
boosting your own
It's boosting your own immune system to multiply, and then kill off the
So do
cancer
you
cells.
suggest that immunotherapy can replace chemotherapy, or in some patients chemotherapy is required and in some
So that's a
immunotherapy?
brilliant question. It all depends on the type of cancer. तो लंग कैंसर में एक टाइप है जहाँ सिर्फ इम्यूनो से काम चलता है.
Okay.
कोलन कैंसर में एक टाइप है जो सिर्फ इम्यूनोथेरेपी से हम सर्जरी भी अवॉइड कर सकते हैं.
Right.
तो इट इज हैपनिंग बट स्लोली.
Right.
अदर केसेस में हम यूजुअली कीमो देते हैं, इम्यूनो के साथ शुरू करते हैं, फिर कीमो बंद करके सिर्फ इम्यूनो चलता है.
So if we specifically talk about breast cancer, so in some patients, depending on the type of cancer and the
बिल्कुल.
stage, they can be recommended either chemotherapy or immunotherapy or a combination of it.
So the most advances in breast cancer have happened in triple negative. ट्रिपल नेगेटिव एक टाइप है ब्रेस्ट कैंसर का जहाँ सब रिसेप्टर्स नेगेटिव रह के सिर्फ हमें कीमो देना था. लेकिन अभी हमें मालूम पड़ा है कि इम्यूनोथेरेपी विद कीमो prolongs the survival and gives you excellent results. All right. तो स्टेज 2 और 3 में आजकल पूरा ब्रेस्ट ट्रीटमेंट बदल गया है.
Right.
हम पहले कीमो, इम्यूनो या टारगेटेड थेरेपी लाइक ट्रस्टोसुमैब, परटुसुमैब, एंटीबॉडीज जो रहते हैं. एंटीबॉडीज नथिंग बट अ वैक्सीन, वाई शेप्ड वैक्सीन. तो वी गिव दीज ड्रग्स, वी श्रिंक द ट्यूमर इवन इफ इट इज स्मॉल. And then we take it out.
You mark it,
you clip it, and then you do a surgery. 50 to 60% cases
it dissolves.
Tumor milta hi nahi.
Yes, milta hi nahi hai. So this is something new. Very honestly, the 2018 is when I had, but mine was a different case. It was DCIS. So, but I'm just saying, in so many cases recently, because you're exposed to the world and you're also sharing whatever little knowledge that you have for the betterment of everybody. तो ये प्रोसेस मैंने बहुत ही ज़्यादा देखा है कि पहले कीमोथेरेपी दी जाती है, ट्यूमर साइज को श्रिंक किया जाता है, उसको क्लिप किया जाता है. मोस्ट ऑफ केसेस जब दोबारा स्कैन करते हैं तो दिखता ही नहीं है, बट क्योंकि क्लिप किया हुआ है, सो दे नो दैट so it leads to a little bit of a lumpectomy
instead of removing the whole
entire breast. So there's something fairly new.
And so, अगर कुछ बचा कुचा हो बाद में तो वहाँ हम ट्रीटमेंट बदलते हैं.
Right.
So that we know कि कुछ सेल्स मरे नहीं हैं और शायद बॉडी में घूम रहे हैं,
माइक्रोइन्वेजन हो गई है,
आगे चल के प्रॉब्लम हो सकता है. तो स्ट्रैटेजी बिल्कुल, रिस्क अडेप्टेड थेरेपी बोलते हैं इसको. तो स्ट्रैटेजी बिल्कुल बदल देते हैं हम लोग. एंड लाइक वी वर टॉकिंग ऑफ एंटीबॉडीज, that has saved so many lives. It's just amazing. And ये दो antibodies HER2 positive breast cancer में use करते हैं.
Yeah.
मेरे काफ़ी पेशेंट्स हैं और हमारे सब ऑन्कोलॉजिस्ट के काफ़ी पेशेंट्स हैं जो ये दोनों एंटीबॉडीज लेकर स्टेज 4 डिजीज में 5, 7, 8, 10 साल ठीक से विदाउट अ प्रॉब्लम बिल्कुल नॉर्मल तरह जी रहे हैं. वो मुझे आके पूछते, डॉक्टर हम कब ट्रीटमेंट बंद करें? आई सेड मुझे सचमुच मालूम नहीं है. देन आई फोन माय फ्रेंड इन द यूएस, मैं कब ट्रीटमेंट बंद करूं? अभी 7 साल हो गए. तो मुझे भी मालूम नहीं है, लेकिन मुझे डर है कि बंद किया तो प्रॉब्लम हो जाएगा. तो ये इट बिकम्स लाइक अ क्रॉनिक डिजीज, यू नो, लाइक डायबिटीज, जहाँ आप लेते रहो अपना इंसुलिन या लेते रहो.
But there's a way of looking at it, because आपने इतनी different ways of treatment बता दिए हैं, इतनी combinations बता दिए, इतने permutations बता दिए हैं, that all that a patient needs to do is show up.
Absolutely.
Just show up at your door.
Yes.
And you will be given a दुकान. क्या चूज करना चाहते हो, कौन सा मेथड चूज करना चाहते हो? इट्स ऑलमोस्ट लाइक दैट. व्हाट्स योर, इट्स यू एक्चुअली पेशेंट्स आर गिवन अ चॉइस ऑफ द ट्रीटमेंट कि आप ये करना चाहते हैं, ये करना चाहते हैं.
So we call it personalized therapy.
Personalized therapy. Because of course, if cancer is rampant, the research is doubly.
It's really amazing.
It's amazing. There's so many things which are coming up.
breast cancer का lobby बहुत strong है.
Yes.
Especially in the US and UK.
Mm-hmm.
That way we women are privileged, because जो advances और जो पैसा जा रहा है research में for breast cancer, perhaps no other malignancy is getting that.
But then also it's become the most rampant from
Yes,
being
you're
the
right.
second highest cancer
in India to
India.
the most common.
I think earlier on it was cervical.
Correct.
And now with God's grace you have the HPV vaccine.
Correct.
And everything. But about that later. But now breast cancer has become the number one.
Has become number one.
So I think which is why perhaps the research is doubling up.
Yeah.
So if there is any way, any other tips that you feel you can share, so that women should not get it only, it should just eradicate हो जाए.
So many patients मुझे पूछते हैं, मैम जैसे सर्वाइकल के लिए वैक्सीन आ गया है, वैसे ब्रेस्ट के लिए वैक्सीन क्यों नहीं है?
Right.
तो मैं एक बता दूं, there are 3 or 4 different types of breast cancer. That is why it is taking time.
Right.
Because there's not one vaccine like there is for cervix.
Right.
Okay, so और ये type कितना clever है कि बदल सकता है. You can go from one type to another when it comes back. बिल्कुल.
Really? I didn't get that. Come
तो
again?
अगर आप ट्रिपल नेगेटिव हो
Yeah.
और आपका रिलैप्स होता है 4 years later, तो वो टाइम पे आप ER पॉजिटिव या HER2 पॉजिटिव हो सकते हैं.
Oh really? It changes
It
the nature?
changes the nature. This is how clever that tumor cell is. तो इसलिए no, to get a vaccine is little difficult, but I'm happy to say that for HER2 positive, vaccines are being tried right now.
Is it that Herceptin which is being given?
Correct. So we are making a vaccine against that type of cancer.
Oh, okay.
This is an antibody that treats HER2 positive, but we are making a vaccine to prevent it from coming. तो ऐसे ये research चल रहा है, and hopefully we'll have it soon.
So are there any government schemes which actually help people and patients?
तो our country that way, I must say, is very giving.
Right.
लोग बहुत बहुत kind हैं, and आयुष्मान भारत की वजह से काफ़ी मदद मिला है पेशेंट्स को.
Right.
लेकिन वो डायग्नोसिस को सपोर्ट नहीं करते. थोड़े मेडिसिन है जहाँ वो स्कीम में बैठते नहीं हैं. तो काफ़ी ट्रस्ट है इंडिया में,
Right.
जो बहुत सारा हेल्प करते हैं पेशेंट्स को. और वी हैव आवर ओन ट्रस्ट, द नाग फाउंडेशन,
Right.
through which we do awareness, we do screening. फिर हमने एक Herceptin fund शुरू किया. So we were giving these poorer patients trastuzumab to make sure they were treated. And we focus on breast cancer. और हम ज़्यादातर सर्वाइवरशिप पे फोकस करते हैं.
Right.
डायग्नोसिस के बाद
All right.
आप अपना न्यू नॉर्मल कैसे ढूंढेंगे? What are the side effects, long-term side effects, short-term side effects? How will you lead your life to the best possible? तो ये होता है survivorship once you've finished with your treatment.
Of course.
So we focus on that, and we try to support research from Indian oncologists.
Right.
क्योंकि बहुत कुछ abroad हो रहा है, लेकिन
Right.
हमारे देश में young scientists, young specialists are not given enough support to do their research. और हमारे ideas बहुत simple है, लेकिन हमारे देश के लिए बिल्कुल fit है. Just
Absolutely.
another way of giving the
Also, it's a
drug.
different gene
बिल्कुल
pool, right?
बिल्कुल
So
and nobody
certain drugs,
studies Indian patients and
yes,
does for
it's
Indian
Asian as a
patients.
spectrum is
We
not
are very
studied
different,
very different
very
from the
different.
European. Absolutely.
हमारा जो build है, हमारा metabolic composition जो है,
Right.
हमारा bone strength, fat comp, सब
It's
अलग
all
है.
different. Exactly. Even when you say the DEXA test that you
Correct.
do, it's on the European or the American way of looking at a body type and not the Asian.
I'm
So
amazed you know that, because that's what I keep telling
I
my
keep reading.
patients.
Yeah.
Because they come, madam, bone density dekho. I said, I don't know what to say to
It's
you.
not the Asian parameters.
It's not.
Yeah.
It's not.
Yeah. Yeah.
So there's a lot going on, lot of trust help.
Yes.
Or kabhi it's very touching, sometimes in the daycare we are sitting and one well-to-do patient will ask a young patient, is there, unka kya chal raha hai ki wo? Can I sponsor her next
That's
cycle?
so lovely.
And we do that. People
That's
come
so
together.
lovely.
They
Of course.
come together. They
Of
give.
course. Of course.
So it's a great system. We have a great system here.
I think we are blessed that way, and it was such a lovely conversation with you.
Not
I
at
could
all.
go on and on
Yeah.
because आपने इतनी simply सब कुछ explain किया है. If I were to ask you one last question, it would be, what is it one thing that you would like to tell your patients, young girls, mid-aged women, old women who are going through the treatment, who have just discovered, maybe just right now as we are talking, they've just got to know that they have been diagnosed with it. And the people who are undergoing the treatment, what is the one thing you like to tell all these women?
So you've given me a whole different population.
मैंने
So
सबको include कर लिया है.
I'm going to make 2 points here. The first thing to the young girls is, please don't shy away from your body. Please be aware of the changes. Try and lead a healthy life. Zindagi बहुत precious है. You need to live it to the fullest and you need to be healthy. For the ladies undergoing the treatment, have the faith in your oncologist, have the faith in the science. It has come a long way and it'll get you out of this problem.
Beautiful. It's just so hopeful talking to you.
You have to be. You have to be.
There's
because
no other way,
we see
right?
success stories all the time. Yes,
We do.
We see the downside.
Yes. But we are hopelessly hopeful. No, I just said it.
But you have your faith. That's all you have in the end, right?
That's what you have. Your faith, your family, I think your loved ones. Now is the time to sort of hold on to these people, value these people, your loved ones, your ambition, actually, your work. If work is that gives you happiness, I think going through a treatment, unless and until your body is not sort of supporting you, please live your life to the fullest.
Absolutely.
If your doctors have given you an okay to go and work, I think work gives you ambition, and it's also a distraction.
And it's
spending time,
fulfilling.
it's
Yes,
fulfilling. Having desires, I think all the women out there, patients or not, it's very important for all of us to have goals, to have dreams, not necessarily professional but personal also. I think it's very important to have goals to live a fulfilling life, like you just said. Very important to treat yourself with a lot of care and value. You're very valuable. Thank you so much, doctor.
Not
Thank you
at
so
all.
much.
Thank
This was
you.
lovely.
Pleasure.
Thank you.
Pleasure.